However, I was just looking at, I mean, that's an interesting commentary in a positive way, that these women were able or gained weight. And whether they triggered an increase in caloric consumption or not, I don't know. The one group, and I think this would be a very pertinent current study to do because of a shift from a lot of people in a lot of the space. Diet Doctor, a few others are shifting into the space, which is the lean, and in fact, the lipid heart lipid hypothesis people are very focused on lean protein, and so it would have been very interesting. You've allowed people to do the standard UK diet with regards to carbohydrates, but I would have loved to seen with this cohort a separate study or an additional 21 days where they ate a super low fat diet. And that would have just been interesting information, because in our practice, we've tried that. And the folks that were on a lean protein diet, which were all carnivores, they were all fat adapted, often insulin suppressed. And we actually thought that we could use protein as a lean protein to trigger insulin, because they're all hypo. So the thought was protein gets converted to sugar, that'll trigger insulin. It failed. But the problem with those folks is they were ravenous and miserable, and they ate a massive amount of food. And they all universally abandoned the low-fat diet. So it was an interesting little social experiment, but I would have loved to have seen that under more controlled.
I mean, our participants definitely decreased in the ketosis suppression phase the amount of fat that they consumed. You know, I mean, again, they were actively trying to follow the UK Eat Well guidelines. So they didn't do what they normally do, which is really fatty food, you know. And so there was a decrease in that respect, definitely. I know that, you know, those who drank tea and coffee stopped putting cream in it and instead put milk, you know, as an example like this, where they were usually eating bacon for breakfast, they didn't eat bacon, you know, so there was these changes for sure. And so there was definitely a reduction in the amount of fat that was consumed. I did have commentary from people saying that because they were trying to eat the carbohydrates, they couldn't consume enough. They felt they weren't getting enough protein. Like it was so hard to eat that amount of carbohydrates and still get enough protein in their diet, that they felt that. And so I would, and again, just eyeballing the photos of the meals. So again, I haven't run any actual statistics on it, but eyeballing it, it looked like they had a decreased protein and fat because they were not eating, you know.
Right. The other question along that diet, and again, I didn't see this in the paper, and it would be useful to go and look at. And again, these are comments or concerns in the community, is to what extent were these people using grain products as their source of carbohydrates? And the challenge with grain, because you measured inflammatory markers, and we know that the proteins associated with grain products can be very pro-inflammatory, and also with milk to a certain extent. So I'm a pro-dairy person, but that's a separate story. But it's the only place in the carnivore diet you get sugar, and that's what we use to trigger insulin. However, could your pro-inflammatory markers that became elevated in P2 be more because of the proteins associated with grain products rather than because of the carbohydrates? So that's the one question. The other question is on a high-fat diet, the type of ketogenic diet, it's very, very low in omega-6 fatty acids, in hydrogenated fats. When you start eating carbohydrates, especially processed ones, your polyunsaturated fatty acid mark comes up and your so-called seed oils go up. You didn't look at that, and that's in the community has also often been blamed for some of the inflammation. Not just
so my participant cohort were very personally aware of, you know, the sort of seed oil versus animal fat and these sort of things. And so, you know, again, they are a very select group of people who are obviously health conscious, you know, to be people to maintain such a rigorous diet and be active testers for that long is a special subset. And so, you know, they were already a group of people who were just not having vegetable oils, and I think I couldn't even pay them to consume vegetable oils. And so
they did not increase in phase 2 and P2 their consumption of seed oils.
No, so they, you could see the ones that were in phase 1 predominantly using olive oil, they still stuck with that and just decreased the amount. The ones who were predominantly going for the animal fats just decreased the amount. They didn't seem to change the types of fat that they were consuming. And they were all, again, something important, they were all people who made their own food predominantly.
Right, so they weren't eating bags of crisps or chips. They weren't eating French fries.
No, although in each phase, the participants, you could see that they had patterns of, like, I don't know, Friday night they'd go out for dinner, or Saturday they go out for lunch. You could see these patterns, and they maintained that pattern still in the suppression phase, but obviously would then choose the carb-rich meal.
But it sounds like a lot of the carbohydrates they were consuming, and I hate this word, but I'm going to use it, were natural carbohydrates.
Yeah.
Were or
there was an interesting, the first sort of 5-6 days, the participants were experimenting around with which carbohydrate foods that they actually preferred to eat on a regular basis. So they were figuring this out, and then which ones actually seemed to suppress their ketones easier for them. And there's definitely a difference there. I would say, just from eyeballing again, it looked like dried fruit definitely was very effective. Sweet potatoes, funny enough, weren't, or rather, what I did see, they didn't actually have such as negative as an effect. And I think it was a case of, like, if you've steamed a sweet potato or baked it, you can only eat so much, whereas I guess dried fruit you can eat probably a lot more in one go.
Not going to snack on a sweet potato. But the other piece also then is that's important data from the study, is that it looks like, for the most, it's a little bit of a generalization, but the pro-inflammatory trigger in P2 was primarily related to sugar, not to an increase in seed oil consumption. And that is an important discriminator. So I point that out, that was an interesting, that's kind of our understanding, but that was an interesting corroboration by the study. The next thing I want to talk about is the commonest medication that I see in my practice that my metabolically challenged or unhealthy patients are on is thyroid medication. 82% of the women that come into my practice, the metabolically unhealthy ones, not those that are already ketogenic, are on a thyroid medication. And I was very interested to look at, and I'm very pleased you reported this, because it's something we talk about a lot, because a lot of doctors will test a TSH, and they'll treat a high TSH without looking at the broad spectrum. And Hashimoto's is by far the commonest, but they never do antibodies. What we saw, and the two numbers that are most powerful in the homeostatic feedback of thyroid hormone, is TSH and free T3. Those are the two correlates. The others, the T4, the total T3, those are relevant. The free T, at least the reverse, you calculate all of those, but I look mostly at TSH and free T3 to look at the ratio. And in my fat-adapted ketogenic patients, both their TSH and their T3 run low, which means that it's not an abnormal thyroid. It's just they're vibrating, they're not doing this. So they are hormonally sensitive. That's why they need very little insulin to keep their blood sugars low. And they don't need that much thyroid, because if the T3 was low and the TSH was high, that's hypothyroidism. But your euthyroid when both are low, and your data corroborated that, which was beautiful. However, in P2, we saw an elevation of both TSH and T3. And they are obviously metabolic governing hormones, but can you explain that? How do you explain a rise in thyroid hormone, all because someone's eating carbohydrates?
Yeah, so, it's exactly as you described. A lot of people, a lot of physicians actually will look at the lower markers and just think, oh my gosh, you've got hypothyroidism and there's something wrong, and likely Hashimoto's. When you understand what thyroid hormone and T3 in particular are regulating, which is gene transcription of mitochondrial electron transport chain proteins, And so, you know, if you are harming your mitochondria more, there's going to be more signal to have to replenish and replace those damaged parts, proteins of the mitochondria. And so T3 is called upon to do exactly that. And so insulin harming mitochondria, doing this by triggering an increase in what's called ceramides. Ceramides then harm the cardiolipin and also harm, you know, increase the reactive oxygen species and harm the electron transport chain proteins. It's essentially going to send out signals that are going to call upon thyroid hormone to come and try to make more, you know.
That's harm. Part of the hypothesis here, or part of the proof here, is that there really wasn't harm. There was an increase in, so we saw an increase in TSH, an increase in T3, and I understand what you're saying there. That's the pathologic side. But
yeah, well, you know, when we talk about pathology, we're not necessarily yet talking about an overt disease presenting itself either. I'm just talking about like when you understand what T3 does, like its actual job.
No, absolutely. But what caused the rise? And again,
yeah, so we might not be seeing a disease, but the signals of knowing that insulin is having those signals on the mitochondria, then those signals will go and call upon the, you know, the body signals, and, you know, will call upon T3 to increase transcription of mitochondrial proteins. It's not yet at all pathological. I mean, the markers in our participants, even though they may have moved significantly in directions that are the directions that we know long term, if it kept going in those directions, would be pathological, they were all within reference healthy ranges, right? So yes, we never saw that going to pathological ranges. But knowing that T3 was called upon, that it went higher, you know, and because we know that insulin does this to mitochondria, and we know that T3 is part of signaling for mitochondria.
You're looking at this through the mitochondrial lens. Did you measure testosterone?
No, we didn't. Our next project is to measure all of the hormones, testosterone, estrogen.
Yeah, you didn't measure HGH, human growth hormone, did you?
No.
The first hormones, testosterone, T3, HGH, and insulin, are your anabolic hormones.
Yes.
And I would tell you that it's a more direct regulation, that insulin directly regulates at the pregnenolone step the production of steroid hormones. And in women, especially the hyperinsulinemic women, and you're seeing a rise in insulin, it triages it away from estrogen toward testosterone. Yeah. And that's why the hyperinsulinemics get PCOS.
Exactly. Yes.
At the same time, you get a reduction in HGH and you get an increased conversion and release of free T3. So to my mind, I understand the mitochondrial theory of harm, but this is a more direct hormonal regulation.
Well, that might be one of the methods that it's also doing it through.
Correct. But this is
because we always look at things of the how it does it, but also to look at the why it does it.
Correct. But the assumption is that in health, you have that homeostatic feedback regulation. And it's not just TSH to T3, both numbers were elevated. And there is an overriding controlling hormone. That's the puppeteer thing. And that is more part of the insulin regulation. And when insulin levels go up, all these things go up.
Yeah, they all change. I mean, this is the overarching thesis of that paper was, you know, aging. So, you know, looking at aging and this regulator of aging. And, you know, how many times we hear when people just, oh, I'm a bit stiff, oh, I'm a bit this, oh, it's just because I'm getting older. Oh, it's just, you know, I'm getting older. It's my aging. And it's like, well, it's actually a function of your insulin. It's a function of how much you're calling upon insulin demand and usage in your body. I mean, we are going to age, definitely, but you know, some of us age faster than others and we get diseases earlier, and that's because of the insulin.
But here's another paradox, is we know that thyroid hormone, especially the active hormone free T3, is a metabolic driver. It directly affects metabolic rate at a mitochondrial level. However, we saw an increase in weight when the T3 went up. That doesn't compute.
It doesn't.
Again, right. So, you know, again, these are holes in some of the physiologic beliefs that we have. So, and I know that this is a normal state.
Yes.
So, you know,
that was the purpose of this study, was to show, you know, when normative population data is looked at, is because it's like studying people who were, you know, given to an autopsies and they're thyroid was already removed and you never knew they had one, because people hadn't been studying long-standing, healthy, long-term sustaining keto people. Then they, it wasn't, people didn't study the behavior of thyroid hormones under that context. And so it's why you see now these patterns in this cohort not looking like the typical so-called normative standard population. It's right. running a counter. And this is why, I felt it was important to study this, because again, if people are going into ketosis, especially from disease, or, clinicians or researchers are doing this, they need a sort of more historical representation data set. And by having them suppress ketosis obviously brings them, it to some degree into the normative population, so that they can have two data sets essentially to compare against.
Sure. And I think that just kind of got the whole hormonal milieu versus the weight is an important consideration. The other interesting thing, when you look at your triglycerides, they did not go up in P2.
No, they didn't.
And triglycerides are predominantly produced by the liver when you convert sugar to fat, whether that source is protein or the source is carbohydrate. And you didn't measure VLDL, which I would have loved for you to have measured, because I would have liked to have seen if the VLDL went up. So there are two sites of de novo lipogenesis primarily. There's the liver, and you would measure that with an increase in triglycerides. And that's fatty liver or non-alcoholic steatohepatitis, which is a pathological kind of a last defense. The majority of the DNL occurs in the fat cells. And by a lack of, so you've got two things. You've got a lack of triglyceride increase, and yet you've got a significant increase in weight, which tells me that in these healthy women, the glucose was being taken up by the fat cells under the influence of that increased insulin, driving into the fat cells, not being metabolized by the muscles because they wouldn't have gained the weight. And you've got the DNL happening at an adipocyte level, but not in the liver. So they were still able to cope. And that also may be the reason why, despite gaining weight, despite having that rise in insulin, they struggled to get out of ketosis because the liver hadn't flipped yet. Does that make sense?
Yeah, absolutely. Yeah.
So that was just something that was intriguing to me, that the lipid markers, the total cholesterol went down, which is an insulin blockade number. And but the triglycerides didn't, and the HDL did not, which means they remained fat adapted, which is to be expected. Yes. Have you seen, in 2004, I'm looking for the title of the movie, because this is basically a scientific study of a really cool movie. And the movie is called, where did I write it down? It's the McDonald's movie where that guy ate McDonald's for 3 months.
Oh, what's it called?
That was an N of 1. And what was it called? I wrote it down earlier today, and I
think because he had a second book called Chew on This, and
that movie was a classic movie in the McDonald's space. And so what this guy did is very similar. He had a normal lifestyle, a little bit on the ketogenic side, not as hardcore as these folks, for 30 days. Now 30, not 21, purely ate McDonald's, and he probably wasn't quite as metabolically healthy as he would have been, but he only ate McDonald's. Now, it was high carbohydrate, but also high fat. And it's called SUPERSIZE Me.
Yes, that was it. Yeah, SUPERSIZE Me, yeah.
And Stoneman, I think, was the guy's name. I may get that wrong. I've written it down somewhere. But what he found, and it was opposite a little bit to, or worse than what you proved. So what you showed is P1, P2, they get worse for 21 days. And then within a day of going back to a ketogenic diet, these women were back in ketosis. This guy took 9 months after he quit eating to see an improvement in his non-alcoholic steatohepatitis numbers and in his lipid numbers. So that is somebody who didn't start out that metabolically healthy, kind of did what you did to the nth degree by overdoing it, and then saw a 9-month and even longer period of resolution and 30-day intervention. You saw complete resolution within 21 days on the back end of this. So really, and why am I bringing this up? Because right now in the US, between Halloween and Thanksgiving and Christmas, those aren't holidays. That is a 2 or 3 month block of carbohydrate dominance. And even the most fastidious, except for these, ultra authoritarian folks, the most fastidious people are still going to have indiscretions. And the issue with in the US, certainly, I think the UK to a certain extent, in the US at this time of the year particularly, you've got to go out of your way not to be fat. It's everywhere. And the question that I have is for those folks that are in ketosis, fat adapted ketosis, if they do have the transgressions over the holiday period, are they going to behave more like your cohort, or are they going to behave more like the McDonald's study folks?
Well, I mean, I think therein lies the really complex answer, because the participants, I mean, these participants were, I mean, out of a whole group of participants that could have been in this study, and there were more that could have been, but it was largely to do with scheduling, that a lot couldn't be in the study, the commitment and the scheduling. So in this larger group of people that I know, as well as these participants, they do come out of, like, they do not, I wouldn't say they come out of ketosis, but they do enjoy Thanksgiving, they do enjoy Christmas, they go on holidays, and then they don't think about it so much on holidays either. But again, I think that when I see the participants that I know relatively well, they don't seem to, let's say, binge, when they do eat carbohydrates. I would say none of them seem to be high snackers. Just by watching,
that forced themselves into this.
I think that they've developed habits over years as well, right? So even when
they may never have had bad habits.
That's the thing. They may never have had bad habits to start with. And, I would say that people who are, who have been regular carbohydrate eaters and then they go keto, they might have developed already historical sort of emotional attachments on food. They might have, all of these sort of things. So it's very different for that kind of group of people who, decide to celebrate Christmas, and, the falling off the wagon is another story altogether.
But isn't that a concern with this study, is that if people read this study and say, look, I've been in ketosis for a year, I've been in ketosis for 6 months, kumbaya, I feel better, my inflammation's better, it's okay for me to fall off the wagon over Christmas and get back on track. And that is very much a diet philosophy. A little bit is okay, every now and then it's, and your study says that is okay because you can self-correct very quickly.
Yeah, well, our study says that, but it says that specifically for this cohort. So
correct, but I'm talking about people who've been on a ketogenic diet for a while, whereas the McDonald's study says not so much.
Yeah, and again, the McDonald's study guy, he may have been low carb beforehand, but how keto was he? How much protection did he have from that keto, if he was in ketosis? I mean, again, our cohort really had been measuring ketones for a long time prior. Just to be able to start the trial, they had to provide 6 months of daily 4 to 6 p.m. ketone testing to demonstrate that they were in nutritional ketosis, that they really were living this lifestyle. And so, how much protection is afforded to them on that to start with. And, again, when they cut out the carbohydrates and went back into ketosis, they really were measuring, and they were in therapeutic levels. It wasn't even just nutritional levels. And so, that potentially having a therapeutic effect, rather than if you just cut out the carbohydrates, but it's not a high fat, let's say.
But here's the question for you. And again, based on your study, and you've seen that someone in ketosis can fall off the wagon for 21 days, intentionally or unintentionally, and get right back on track within a day. If I'm a person reading this and I'm in ketosis, would you, based on your study, say it's fine to fall off the wagon over Christmas because if you get right back on track, you're okay? Or would you say, despite the study, it's probably not a good idea?
Okay, so they get back into ketosis, they get back into nutritional ketosis in a day. We measured the blood markers that had changed 21 days later. If we'd have measured those blood markers again just in one day, the ones that had become inflammatory. They
3 weeks is a very short period of time. I mean, that's so the question.
So it is 21 days, but what I'm saying is that, you know, they get back into therapeutic ketosis in 1 day, but they clearly sustain it at a very high level for 21 days, right? That's sustaining, they're not sort of getting back into ketosis in 1 day and then not in ketosis for the weekend that follows, so to speak, right?
But what I'm saying is that your paper pretty much says it's okay to fall off the wagon because you can get right back on.
Yeah, in this cohort.
And in the longer term, over the course of 3 weeks, there's no harm.
Yeah.
And what would you say if that was the take-home message of your paper? Would you advocate for that, or would you say, be very careful, it's probably not a good...
I mean, we write that in the paper, that this may not be the case for, you know, if you were to continue that pattern. First of all, 21 days is not a chronically long period of time. And again, we do stipulate this is for this cohort of people who had no prior metabolic health disease, and it's a one-time excursion in 1 year, you know, so it's not, you know, 21 days every other 21 days. And again, it's coming from people who have never had metabolic disease. You know, again, if we're dealing with someone with cancer, for me personally, I wouldn't, because I'm interested in aging and longevity. So, you know, looking at these changes in these markers, I'm like, even though I correct them, there is an impact. There's going to be some level of impact subcellularly, and, you know, on my DNA, on these sort of things. And so I personally wouldn't do that. And that's why I'm always saying this was a study of, you know, not saying everyone should go away and do this. And it's saying that just this one time, you know, over, like I said, you know, the group average was actually nearly 4 years. You know, we say if you were to repeat this and keep this pattern going along, it's likely not going to revert back healthily or look good.
This is what we did as a species for survival every year. We intentionally did this for a few months when carbohydrates were abundant, so that we were more likely to survive the winter.
Yeah.
Again, I mean, that's the historical theory, but is that not what we did, and why is it bad?
Yeah, so, you know, I mean, if it is very likely that we did it, especially in certain, I would say, geographical areas of the planet, but not necessarily in all, right? I mean, if you go more north, I mean, how much carbohydrate would have been available for the...
But even the Eskimos, I mean, that's the group, or the Inuit, that's the group that everybody upholds as this mythical, but they would have berries and fruits in season toward the end of the season when they were ripening.
Yeah.
So, I mean, that is an intentional drop out of nutritional ketosis.
Yeah. And my participants, you know, they definitely were not, again, because, you know, we even saw in the 6 months lead up, you know, they didn't have no carbohydrate days. They had days where they had full on, you know, a full carbohydrate, like a proper meal with carbohydrates, like not a small amount. But it never, because it was one time in the day, it didn't cause them to come out of nutritional ketosis effectively. And so, you know, again, this is a female cohort, so a lot of, you know, information that we gathered, that obviously their dietary patterns would change based on their monthly cycle. They would be affected by that. None of them seemed particularly afraid of, you know, Christmas and birthdays and things like that. They did this cohort.
They're non-events for them.
Yeah, exactly. Yeah, exactly. And then, you know, for myself, it's just, you know, again, you know, this is just by default, like from very young, I've just always, my palate was favored that way.
Right. And that's, if you don't smoke, you're not going to smoke on Christmas.
This is it.
But I just, again, for the messaging for people reading this, I don't want this to be permission to say this is